Welcome, Ngaa. We appreciate you coming, and we, can't wait to hear what you have for us. Thank you.
Awesome. Thank you for having me.
Yeah.
I am Ngaa Murombedzi.
Murombedzi.
My friends call me Ngaa.
Okay.
And everyone else calls me Ngaa. And
Okay.
I'm with the AIDS Healthcare Foundation.
Very cool stuff. Very quickly, before we get to the conversation, like I mentioned a second ago, I'm very big on names. I don't know, can you hear us? Do you want to use that? Yes, there we go. I'm very big on names, right? So I have one of those names that are not so popular. Musi. I think the only Musi that South Africa knows. If you don't know, it's my
there's
man.
also, yeah.
It's my man.
Musi, my man.
The only
yeah.
Musi that South Africa knows is my man, right? But very soon, Musi Mist from the Vuga Breakfast Show is going to be known. So, Ngaa. What does Ngaa mean?
Makabongwe Nkosi. The Lord must be praised. The Lord must be thanked.
And it's a good Friday, so
We gave praise, and thanks to the Lord. I love that. Such a cool name, man. Welcome. Like we said, we appreciate you. So let's quickly get into it. What is AHF, and what is your guys' involvement with the Rancho 2025?
Sure. So the AIDS Healthcare Foundation is the largest independent provider globally of HIV care services. And in South Africa, we've been here for 23 years, since 2002. And our first clinic was in KZN, the Itembala Bantu People's Clinic.
Okay.
So essentially, we partner with departments of health across different countries. We have 47, now 48 countries of operation.
Oh, wow.
We've just added Ghana to the list.
Oh, nice.
And we had Tanzania join us last year. And we work with ministries of health to ensure that services for HIV are patient-centered. Advocacy is aligned with ensuring that people living with HIV have a dignified experience of that. We ensure that when it comes to facilities, how can we support the gaps that usually manifest? So things that are impacted by resources, things like human resource capital, data capturers, doctors, nurses, linkage officers, and the like. But we also work in supporting the infrastructure. So in some areas you will find that we have supported with like park homes or the development of buildings. So it just goes, we work on a response basis. We are nimble as an organization. We try to respond to the need so that overall we provide cutting edge services and advocacy for people living with HIV regardless of ability to pay.
Wow, I love that. I'm going through your site here, and it actually says exactly what you just mentioned, that AIDS Healthcare Foundation, cutting edge medicine and advocacy regardless of ability to pay. So look, man, over the years, or rather when we were growing up, and I think in the early 2000s, we mentioned this, TC, if you can remember, a couple of weeks ago, that I think early 90s, early 2000s, in South Africa specifically, that's where, the AIDS pandemic hit the southern part of Africa, and people were losing their lives like no one's business. And some of the misconceptions or the things that we grew up hearing is that, the information that was trying to be given to the general public was that AIDS can be managed. And there are people who've been living with AIDS for the longest of times, right?
HIV.
Yes, HIV.
Yes.
For the longest of times. Yes, let's correct that one. Yes, right? But we've heard things like that. A lot of people fell victim to, the psychological part of it, rather than the disease in itself. So for someone who grew up hearing all of those things, how true is it? And now where does the disease find itself in terms of the volume and the light that's being shed to it? Because when we grew up, there was so much.
With Nkosi Johnson.
Absolutely.
At that time, it really did seem like, it was a time of a lot of, a lot of fear and stigma.
It was a dark time.
Yes, where surrounded the disease. So now going back to Musi's question, I would really love to hear your answer on that.
So you don't succumb to HIV.
Okay.
You succumb to AIDS.
Okay.
Or other co-diseases. So like TB can kill you if your immune system is weakened by HIV. If you don't treat HIV, so get your viral load under control, it can progress and then it becomes AIDS, so acquired immune deficiency syndrome.
Yes.
Right? And that means your body has essentially lost its ability, its defense force against fighting illness. So you then succumb to the illnesses that can attack you if you're living with HIV and you're not treating it. So the biggest thing we always need to advocate for and to ensure people get is adherence to treatment if you're living with HIV. So take it right right, take it always. Get your viral load to be suppressed
Yes.
and retain on that treatment. So one of our biggest campaigns is on retention, because like you said, the psychology around
Yes.
HIV, around
Yes.
treatment, it's like with any chronic illness, people living with high blood, that's why we always have to tell our grandmothers,
Yes.
take that medication,
Medication,
is
yes.
because you do get to a dip of fatigue. You have to do this every single day
Yes.
for your entire life.
Yes.
But the other side of that is you can thrive.
Yes.
So, personally, I like to refer to people thriving with HIV, not living with HIV, because your life is in no way impacted. In fact, I could drop dead today from
Yes.
hypertension before
Yes.
somebody living with HIV drops dead from HIV,
Yeah,
right?
I heard those kind of
Yes.
statistics where they were like, you are most likely to die from diabetes
Yes.
or high blood pressure before you can die from HIV
Yes.
based on the strides that
have
have
been
been made in medicine in order to combat and not contain yes,
HIV for the public. I think we grew up around the same generation,
Yeah.
or maybe a little bit ahead of you guys. But I was just saying to the Uber driver that brought me here that HIV used to instill the fear of God in you.
Yo, it
definitely.
did.
Not even AIDS. Like, you did not want to be
Like,
associated.
as they would
Just
refer
even with
to it.
someone living with it,
With it.
or even if someone in your
Suspected.
family had it, you had to. It was like such a shame. You had to keep
Yes.
it quiet.
A secret
It was a
stigma, the
secret.
discrimination.
I mean, just personally in my life, I could see like with my mom, even at her age, she's an old lady, but she still lives with because of that. During that time, that fear that she still, without even at her age, she's always insisting when she goes for medical checkups. Please take my check my HIV status.
Yeah.
Yes.
Yeah.
And that's why we have to keep, I don't know if you remember the ABC campaign.
Yes.
Abstain, be faithful, and condomize.
Yes.
And then that fell to the wayside. Now people are fearing pregnancy before they're fearing HIV, because HIV is discreet.
Yes.
If I take my medication and
No
I
one
use a
will
condom,
know.
nobody will know. But pregnancy is going to tell you what you're
Yeah.
doing. So we need to really get back, and that's why we find ourselves in this space here. That's why we try to partner with communities. That's why we lean on the media to say that, look, it's not the forgotten disease. It is still as hectic as it was then. It's just not as dark. So you remember a time, the Nkosi Johnson time, the I don't want to name him here. I don't know if I'm allowed to name him, but our former president and the denialism
Yes,
that
yes,
drove
yes, I
us
remember.
into that
Yes,
dark hole.
yes.
Those are all realities. And unfortunately, the stigma and the discrimination, it has not fallen away. In fact, it has become self-stigmatizing and self-discriminating. So someone is more afraid of speaking out about their status because they fear how people will retaliate. Not necessarily that they have seen that people will retaliate in a negative way. So we advocate a lot around empowerment of people, because remember, we now have generations of people born with HIV.
Yes, yes.
Nothing you could have done could have changed that
Yes,
for you.
yes.
And yet they live in that state of stigma. So we want to ensure that people have access to condoms. Governments continue to support HIV response, prevention services, adolescent and youth-friendly services at facilities, because young people say, I don't want to go to the community clinic because Umam Fundisi is there. She might see me seeking condoms. Then she's going to tell my mom. So we have gaps and spaces and blind spots within our intervention that we need to ensure that people start to consciously address. Then the other side becomes resources. So you introduced as part of the Rancho's corporate social investment,
Yes.
we are now looking at taking our advocacy to PPP, private-public partnership.
Oh, wow.
So the government must work with the private sector. We fall into the private sector, but so does Investec, so does Discovery, and so do all these massive entities that have got big budgets and big returns.
Yes.
And we essentially want to say, where you are here, if you're a bank, I mean, we're trying to get into working with DBSA, we're trying to get into working with regional bodies so that we can look at how can we innovatively fund HIV response. There are countries that have done successfully. Zimbabwe has an allocated AIDS fund. South Africa has done strides in responding to that, but money is not an endless pot. At some point, it will deplete, and we will find ourselves with pants down, as we have
Yes.
since this year.
Yeah.
So we are here trying to say that, look, First, it's not a forgotten disease. Second, young people are amongst the highest population of new infections of HIV, as per the latest report out of the UNAIDS. We are finding that we have young mothers, we have teenagers at risk of falling pregnant, we have people in the workforce that are not having these conversations. But more importantly, how can we take these spaces, normalize condoms, have fun with your sexual reproductive health rights, have the conversation in a way that lands with your community.
Yes.
You know, we're moving away from the English. You come here and then you tell me biomedical intervention. And you're like, I don't know how to spell that. And then in your community, how do I speak to my people about
like,
that?
in a language
In a
they
language
can
that they
understand.
Relatability.
Yeah, so
Yeah.
we like I said, we're nimble. We are not stuck in, okay, we have to respond
The
1,
early
2, 3.
2000s,
Yes, at the most, what we ensure is that our services are always patient-centric. We get into these spaces. We're not asking for the money. We're educating the people with the money to understand what innovative health financing looks like, what domestic resource mobilization looks like. Because as much as we advocate for HIV funding, if we're not treating TB, we're doing nothing. If we're not treating STIs, of which HIV is an STI, I heard
Yes.
somebody who said, no, but HIV is and then the STI is gonorrhea. And I was like,
it's sexually transmitted.
yes. And I
Yeah.
was like, I won't judge you from your age, but I might say you don't have Google.
Yeah.
So, you know, we really try to, that's become our biggest point of focus, to ensure that we will always have resources for HIV.
I love that, man. So talk to me. You just highlighted something that, you know, South Africa is experiencing now with regards to, you know, what's happening between the two countries. And so what impact does it have? Because I see here, and you'll correct me if I'm wrong, but the thing is based in Los Angeles, right?
Yes, we are.
So with all the controversy that's surrounding, how do you guys move, giving the awareness to the people? Now, how do you guys navigate that, especially as an international foundation now?
So, like I said, we have now 48, could be 49 countries of
Yes.
operation. We remain committed to serving the 2.3 million lives
Yes.
in our care, to ensure that their services from us are not interrupted. And we come in from the advocacy angle. So I won't speak directly to the current reality.
Yeah.
However, we do now go in. You've heard me speak about PPP.
Yes.
We are engaging regional bodies like SADC, like the East African community. And we are now looking at how do we ensure that governments are the ones taking the full responsibility of health financing. So for us as an entity, our patients are paramount, and we ensure that none of that is interrupted. We have not had to do anything around our existing partnerships with ministries of health in response to that, but we have amplified our advocacy. We have now taken on working with parliamentarians. We've participated
nice.
in the APACO 15 and 16.
Yeah.
We are getting into the spaces where we cannot take it for granted that information gap is a reality.
Yes.
Parliamentarians, yes, they get into our, you know, you've seen our parliament.
Yes.
But how do we ensure that they come forward and they're well equipped and they're well informed and they can go back and reach communities? But at the end, it right in the center of that is to ensure that we don't drop the people that are already in our care.
I love it, man. And I love how you mention advocacy. You know, I love it. I resonate with that. So advocating for people to be well informed, like you just mentioned, and be well equipped to know how to navigate the space, you know, that is surrounded by a whole lot of stigma and, you know, taboo, essentially.
Yes.
But now you mentioned that, and this is something that I feel as well, that it's sort of come to a point where it's like, or it's acting like a forgotten disease, right? Because I remember we used to do something around December. You remember when everyone at the beginning of December would wear like
We do
a red
that.
ribbon?
We
Now a whole lot of people in society have stepped away from that. You know, there's a whole lot of these other diseases and pandemics now that are at the forefront. We know COVID is the biggest one now to date,
yes.
and it's like what 4 or 5 years later, and it's still on our lips and we're talking about it, right? But there was a time where AIDS was the thing, and in December we knew everyone wears those red ribbons.
The red ribbon
right?
on the 1st of December. Yeah.
So now to try and, shed some more light and awareness and give this information and knowledge, what are some of the breakthroughs that we as the society can look forward to, and the changes, if there is any changes with regards to the space of HIV and AIDS? Are there any prevention changes that we can look forward to? Is there a thing that we can go online and Google and say, oh, maybe this is something I can do? How do you guys navigate that space?
Okay, so I'm going to speak to World AIDS Day first. So it's one of our biggest activations across the globe. On the 1st of December, in and around the 1st of December, we continue to ensure that that day is front and center and remember those that have succumbed to the disease. But throughout the year, we also have activations. The year always kicks off with International Condom Day. AIDS Healthcare Foundation pioneered that. It's now become a globally observed holiday, well, not holiday, but like commemoration day. And we go out and we make condoms popular again. Safer is sexy, just to use it, always in fashion. And then as the year goes, we look at intersections around HIV. So you look at prevention, which kicks us off, being condoms. And at the end, let's remember HIV as a reality as the year ends. But in between, we've got Menstrual Hygiene Day that's coming up on the 28th of May. And we look at the intersection of menstrual hygiene, health and services, and HIV. And we have World TB Day. This year we partnered with National Department of Health here in Gauteng in Western area, and KZN held their own standalone, because we always look at HIV in isolation, TB in isolation, but those are sister diseases. In fact, more people succumb to TB than HIV and malaria combined. So we keep combined. So we keep a finger on that. And then as the year goes, we have Day of the African Child. This year we're going to be focusing on CSE, which is essentially that campaign, Protect the Child campaign. And under there, if you see my T-shirt, we've got a campaign called Switched Up, and that's making CSE access through the empowerment and utilization of digital services. So we're innovative like that.
Nice.
Then we look at gender-based violence. For South Africa, we focus on National Women's Day, and as the year goes, we have International Day of the Girl Child, International Day of the Boy Child, and then we reach World AIDS Day. So within each of those, we're looking at the intersections with HIV. When you look at menstrual health, there are communities where young women are they're exchanging sex for menstrual health services. And I remember this one story when I was in Eswatini, one of the countries that I support. There was a young girl in grade 7, straight A student, bright future, rural community, and she was pregnant. And when the community, obviously, and teachers spoke to her, she had needed roll-on and a pack of pads. And it's not unusual. And that girl was pregnant. Now she will fall out of school. She will become a statistic. How do we stop that? So that intersection, young girls are at risk. You can't negotiate safe sex. If you're having sex with somebody who is 3 times your age, who has money, so why do we continue to advocate for that? How do we build empowerment? Sexual reproductive health rights, CSE, those are conversations that we know as the converted, if I can call us that. We know they're important. But there's fatigue in community. Okay, guys, you're telling me about HIV again. But they've been progressions. So in terms of what innovations and advances have happened, gone are the days of the ARVs that was that big stack.
Having to take like 6 pills 3 times a day.
One's like the size of your eyeball. So, it's now down to we have biomedical interventions. Which means our advocacy is no longer just on one thing. As much as we advocate for adherence and retention and primary prevention being condoms remain the only way to protect yourselves against HIV, STIs, and teenage pregnancy. But we are also not oblivious to the fact that we have made strides in HIV prevention and response. There's now PrEP and PEP as injectables, discreet. So we need to ensure that young people, especially young people that are opting to make use of PrEP and PEP, your vulnerable communities, men that have sex with men, your gay population, your LGBTQI, and I demarcate them separately because their experience of sex and the needs that they have primarily is different. When you now look at that, you have to ensure that we are not just punting on the one side of condoms, but make sure that they know how to use this PrEP, how to use the PEP, what are the time frames, how many do you take, how do you take them, if you're at risk, what does that look like, what is that? Because we have many pockets that can't access condoms, but also can't access PEP. Now you're saying use PEP. Some people don't even go. They go to TikTok and the favorite person is just like talking about PrEP and PEP, and they're like, oh, nobody's talking about condoms, so let's leave that to the side. But condoms are cost effective.
Yes.
We distribute those freely. We give Icon and Love condoms. If you pop by our stand, you'll see them. One is gold, one is red. They're awesome to look at. Now, when you look at that, there is gaps. So we need to always ensure that we are responding to the current realities. We're not necessarily married to the messaging we've been giving, and ensure that now we advocate. I was happy to hear during the Close the Gap campaign, it was facilitated by Minister Motsoaledi. It must have been in earlier March or Feb. And he said that when we are now talking about prevention, let's start to look at what is that combined prevention, the combination prevention for HIV. Now we're looking at biomedical, and we are looking at your traditional ways of preventing HIV. So yeah, we try to respond. There have been many innovations, there have been many realities, but the one innovation we want to integrate with is the power of community voices. And we actually then started piloting community power voices. And those are the people that say, guys, you want to come here with your big English, that's not going to land. You need to come here and understand how we speak about this. Let us be the ones who go to speak to government. If it's an issue of infrastructure in rural Dochwa, you are not really privy to what that looks like on a day-to-day for us. But if you give us the capacity, we can go and we can speak and advocate for ourselves. So we really try to ensure that communities are at the center. You know, it's always been nothing for us without us, and we try to work with communities so that we're not leaving them behind.
I love it. Community-based involvement.
Yes.
I love that so much. You know, you've touched base on so many things, TC, and there's a whole lot of questions that come up from all of these points that you touched based on. But the one that I want us to go into, because you mentioned that these demographics are separate, and you know, they are not in the same thing, though the community falls under one umbrella, right? So someone is sitting out there wondering, is there now a specific population or demographic that your foundation focuses on, or as well as the disease and the virus in itself? Have you found that in your research and over the years it targets a specific demographic or race or population of people that are more privy to fall victim to it?
So we don't have flux in South Africa, but globally, especially through our domestic office, we have flux that focuses on the LGBTQI community. And when I say not in South Africa, I mean we don't run it as a program, but in Cape Town, you may find there are people hosting flux. And basically, we have shifted to, and I'm not sure which research we leaned on, but it is on findings of realities on the ground, the population of men that have sex with men. And it's essentially around the stigma around that, the discrimination, the secrecy, they don't go to seek the health services the way your cis community is, your heterosexual relations, even your gay population is, because men who have sex with men, some penetrate, some don't penetrate, some are and vice versa. And those are the realities. Like I said, we want to learn from the communities how best to serve them. So we actually conduct surveys. With most of our interventions, we facilitate focus group discussions. We have not seen, I can't say concretely, we have not seen anything around race that we have focused on, simply because that was stigmatized. So we try to move away from anything that can pose stigma. Imagine we start saying that it is prevalent amongst black men, what that's going to do. So we try not to stigmatize in the way we deliver our messages and our messaging, but we do try to go to the communities and actually understand and see. We lean on our M&E department, and when we look at our stats monthly to see where we're seeing a spike. So I would say in a non-discriminatory way that the adolescent population, your 15 to 24, remains the highest at risk. And then you take your aging with HIV. So people that have been living with HIV, maybe it's fatigue that has gone them, so they've hit the cusp of your 50 pluses. So there is groupings where we're seeing a spike, and that's not necessarily anything that has to do with their makeup, but you could take a look at the behavioral component. So, you've got your 95, 95, 95, and I'm always advocating and saying I support people that say the last 95 should be behavior and community focused. So how do we ensure that we get the people to test, the people to retain, know their status? How do we ensure that cycle closes by ensuring that we support the behavioral component? And that's where we find the different populations. But that's just, it's statistical. We're finding a lot of new infections amongst your adolescent population.
Wow, that's very fascinating. I mean, 15 to 24, that's crazy, man. And, because you mentioned that we almost grew up around the same era and, we're almost in the same age bracket, right? But for me, it's crazy to find out that these little kids...
It's the young, it's
15 years ago.
Teenagers.
Exactly. 15 years ago was like what?
So from
2007,
teenagers to, like,
2008, right? To young adults, kids who were born in like 2001 to 2003 are the ones who are most privy to fall victim. 2010, as soon as 2010. Go World Cup, guys.
Yeah,
That's
World
too
Cup
crazy.
babies.
That's too crazy. That's too crazy. So now, you guys are doing so much great work in and around the world in different communities. And I love how you, like I mentioned a second ago, community-based involvement, right? Not saying that because we are the ones who have this information, we want to give it. Let's work with the people on the ground, people who are living with these people, who know the day-to-day struggles and the spoken languages in that area, right? So with all of this work that you guys are doing, I'm sure there are challenges, right? You guys come across all these challenges, and that could differ from person to person, demographic to demographic, place to country as well. What are some of those challenges that you have seen are the most significant ones and the most consistent ones across all these, I guess, categories that I've mentioned, and how do you now try as a foundation to overcome them and, make successes of those challenges?
Absolutely. So there's always three that I reference, and the first leans to that imagined fourth 95, the behavior of people, the community attitude, the stigma and discrimination falls into there. The second is political will, and for me, that is the biggest one. If there is no buy-in in the people that can make decisions to ensure we have resources and facilities for people living with HIV or preventing HIV from ravaging our communities, we need to get political will. Until our president stands up and says, we have not forgotten HIV, until he says, I stand and say, just use a condom, or he says, test and treat, or he's saying, I remember campaigns where you would see the political leadership going to test because they are leaders in our community and people want to see that. So until we get political buy-in and political will. Now, I say that without saying that we don't have sufficient. If we still have to advocate, it means there's still a gap.
It's not sufficient.
Yes, but our leadership needs to really step in and make HIV a priority. How are we putting it not only on our parliamentary floor for our parliamentarians to debate, but when Ministry of Health is putting together the budget? Are they putting HIV front and center? How do they get, it's not one department, so it's not just for Ministry of Health, but how do we get the entire portfolio to make a commitment? And that could be a challenge we can put out to them to say, how is our political leadership contributing to communities taking up HIV testing, treatment, and care? And then the last one is to get resources. So resources remain a big thing. Communities need resources. People need resources. So resources I don't mean from the advocacy side, but even things like getting taxi money.
Oh, yes.
How do you get to the
Just
facility?
To get to those clinics.
Yes, and be tested. So how we respond to that is how do we then go into communities on outreaches and ensure that once a month we go to test and dispense medication. So those are things that we need to collaborate with, because remember, communities have gatekeepers. If they don't invite us in, we can't really go in. Yes. So, and that again comes to political will. If we start normalizing the need to speak about HIV the way we spoke about HIV back when it was ravaging communities, without instilling fear, we don't have to scare the life out of people to get them to buy into the HIV narrative. We can really just bring information. We can build champions. So many people have been infected and affected by HIV. How can they come and bring their stories and garner political will I'm passionate about storytelling. I am an anthropologist by profession, so I believe in the power of utilizing and harnessing stories.
Yeah.
I can never tell your story as a black man because I am not that. It's never going to be my
And
lived
vice
reality,
versa.
and vice versa.
Yeah.
So how do we build capacity? I can never tell the story of somebody who lost a parent to HIV. That was never my reality. I can speak to how it feels to have been a young Zimbabwean girl who was orphaned by TB because that's my reality, but it doesn't transcend borders. So how do we build capacity for communities to come up? We must stop thinking that communities don't know what they need. This top-down thing, it must stop. We need to say from the communities, what do you need? First thing they'll ask for is money, but more.
Actually, you're right.
Yes.
Yeah.
But after that, they will tell you exactly what they need, and then we tailor with them. We need somebody who sits in a portfolio that works with civil society and is passionate about civil society, is passionate about giving them the platform and not bringing the light to themselves, is passionate about taking and going to stand in front of the president saying, this is what civil society has said. Listen to them now.
Yeah.
Those are the kind of people that we need. So those three elements, those are the things we really need to get if we're going to get a harness on HIV.
Sheesh. So much that you are giving. And I feel like, this is an unending conversation and there's so much to even explore, if we were to talk about it, we would not finish.
would not
But we
finish.
would absolutely love to have you back so that more light is shed on this conversation.
Yeah, and perhaps when you do your campaigns and whatnot, we can help cover,
Yes.
those activations and campaigns
And the initiatives, yes.
and initiatives,
Yeah.
because this, like you said, is a matter of public service.
Yes.
Yes.
Because it would be helping communities and society as a whole to get this information and content out there.
Yeah,
Amongst the people, and help in the advocacy for the people already who live with the virus to have dignity and, of course, get accessibility for everything that they require.
Yeah,
Absolutely.
very cool stuff. So, Ngaa, talk to us. Someone is out here at the Rancho and is not aware that AHF is here, right? And that there's an exhibition and an activation with regards to the space of AIDS and HIV. Where do we find you guys, and how does one get involved when they pass through and want to come and visit your space there?
Awesome. So we are exhibiting in Hall 5. We are stall B07. When you come in through the big gates from the quad, you'll find us behind Sasa and Sanbi.
Okay.
And when we've got this red banner, we've got fun stuff like selfie boards that say just use it. We've got
Nice.
lots of gold and red condoms there. And you can also follow us on social media. So on Instagram, we are at AIDS Health SA.
Okay.
That's at AIDS Health SA. And then on Facebook, we're AIDS Healthcare Foundation South Africa.
Yeah.
And when you come and take a selfie with us, please do tag us and bring your friends. We also have, like you said, HIV testing happening there. We've got our
Yes.
counselors, we've got our Girls Act that have been part of the program, exhibiting what they've learned around being empowered as young women and young girls. And we also have some fun questions. Like I said, I learned some people don't know how to put on a condom.
Yes, still, that actually is still a thing, guys. It's still a
Yes.
thing.
I mean, it's funny, but
But it's a
thing.
reality. It's a
it
crisis
is.
because
It
these are
is.
grown people.
It is.
Yes. Like the adults, not my
Yes.
kind of adult. The other one. So please do come through, come and grab some condoms, come and get a t-shirt, come and answer questions, come and ask questions.
Yes.
You can scan and find more about us. We've got cool prices. We've got like fanleys that are written, just use it. They are not Stanleys, guys. They are fanleys, but they are
Fanleys.
awesome. And yeah, come through. Let's chat, let's see, and bring questions.
Yes.
We can always exhibit and tell you what we know, but we love to hear what communities are thinking as well. So please come drop a question.
Sure. Is there a WhatsApp line maybe that we can reach
We
out?
do not have a WhatsApp line simply because of privacy.
Okay.
Yes.
Okay. Very cool stuff. But you said mentioned that on across social media platforms.
Yes.
On Instagram is at AIDS Health Foundation SA.
At AIDS Health SA.
SA.
Yes.
That's on Facebook.
You will find our motherboard, AIDS Healthcare Foundation. That's also there. You're welcome to interact with them, but we are at AIDS Health SA.
Very cool stuff. You heard it first right here on the Vuga Breakfast Show.